And just be mindful. Okay, so let me welcome to our BOG exam preparation series. Today we're going to be covering the topics of quality and performance management, as well as management and leadership. So two separate uh, PowerPoint presentations for you all. So we'll just go here. If you want to advance, okay, I think I have the screen advancing. So let me see here. Whoop, there we go. So here I am. You guys know me by now. And here we have some updates and FAQs. So just some reminders of some links here for the healthcare governance, I think is what we um, covered last week, actually. Okay, so quality and performance management covers a number of knowledge areas. Um, you know, obviously, principles of benchmarking principles and sources of best practices, risk management, which includes all those areas there listed on the slide. And then process improvement tools. If you're a Lean Six Sigma, I know a lot of us are. So that knowledge base comes in handy for this section. And then a utilization review and case management for all you clinical folks too. Okay, well, we're going to jump into the very first question. Critical paths are important because they. So let's just read through the options for the answer. First, provide support in malpractice suit. B, delineate best practice protocols. C, increase patient throughput. And D, reduce resource use. Um, so I think the first question, when I am doing multiple choices, I always look to what answers can I first eliminate. So we eliminate here A, because I think provide support in malpractice suit does not really have, it could critical paths, which, if you know what critical paths are, they're just uh, templates to help decision makers in quality and performance management. And they may, if you are sued, they could provide support, but I don't think that's the best answer here. B is delineate best practice protocols. I might have given away the answer in defining, at least from my perspective, simply what critical paths are. But let's look at C and D just to make sure that B is the best answer. Increase patient throughput. Possibly, but there's so many things that impact throughput, and critical paths would not be like my go-to if I had a patient throughput problem. And then reduce resource use, possibly because obviously the critical path is giving you some guardrails, some guidelines as to the care that the provider is providing. But I still think that B is going to be your best answer here. I don't know in the chat, a lot of times people in the chat like to put some answers forward. Richard, I know you're my chat monitor. Do we have any people in the chat with
We have a couple people who agree with you on B.
B? Okay. Well, let's see. Let's see what the answer is. B it is. There we go. Any questions? We'll move next to, I push the button really quickly when I ask for questions, but maybe we'll just get questions at the end, unless you have something very specific with the question. Which characteristic of a high risk process would tend to increase the risk of a process failure? So one word answers. Tuffy. Okay, first is A, simplicity, B, consistency, C, variability, and D, automation. Okay, so we're looking at what are characteristics of a high risk process. Again, that would tend to increase the risk of a process failure. So your answer is going to increase the risk of any of the process failure. Regardless of whether it's a high risk process or not, I think that we can just look at the answers and maybe what comes to mind, what we can eliminate first. That's my approach. So, what would increase a process to fail? Simplicity. Usually, when things are simple, straightforward, there's less likelihood that the process will fail. Consistency. Typically, that's going to reduce the risk of process failure if something's very consistent. Variability, I'm thinking that that is definitely something that we could consider for the answer to this question. Automation, when something's automated, obviously reduces the risk of process failure tremendously. So I'm definitely going, this one seems pretty straightforward to me because simplicity, consistency, and automation, they all kind of seem like heading towards one direction, whereas variability, when anything has a variability in it, it has a greater risk of failure. So I am looking to see any, before I click the button, Richard, do we have any
Um,
uh,
Other people are saying C, and I just wanted to point out also that it's important to see the word increase because it's really
things?
easy to think, oh, what would make it better? We're talking about quality, and you start looking backwards. So this one is sort of like a negative question in that sense.
Exactly. We're looking at what answer would increase the risk of process failure, would be more likely, and C. We've got some good, on the right track so far. Okay, question number 3. In conducting a risk assessment, what would be the first action to take? So I'm going to hone in on the word first because that before I even read the answers, these answers may be included in a risk assessment, but they may not be the first action you're going to take in a risk assessment. So we'll start with the answers here. A, identify the steps in the process of concern. B, identify what could fail in the process. C, identify causes of failure in the process. And D, identify priorities for action. Okay, I'm gonna try and because this one is a little bit tricky, but because we're just looking at what's the first action, anything I could process, probably eliminate, I'm gonna eliminate C as identify causes of failure in the process. Um, because that's kind of like the root cause, looking at the root causes of a process. And I don't think that's the first thing, the first action you're going to take when you're going to be conducting a risk assessment. Um, Typically and I'm getting into a little bit of knowledge base here, but I want to look at a process map, the current process. That's typically whenever I'm going to do process improvement, the very first thing in any process that I'm going to improve, I'm going to look at the current steps in the process and then identify those that are of concern. Identify what could fail in the process. That's a question that maybe when you've developed a new process, like you're doing a best an improvement where your future state there. I'm searching for my words this morning. I apologize. If you're looking to your future state of your process, that in that future state, a question may ask is what could fail in this future state process, what you want to improve the process to be. And then identify priorities for action. That's more of, your implementation plan, possibly after you've done your future state and you're looking to implement your new process improvement. So, of the four options, I am, and again, honing in on I'm doing a risk assessment and what's the first action I'm going to take. I'm going to select A. Do we have any contrarians or any agreement, Richard, on
It looks
first
like
action?
it looks like we have this really smart group of students because they're all agreeing with you.
Okay. A it is, yes. So let's go on to the next question. Oh, a longer question here. In designing a risk management program for your organization, what approach would have the most impact on reducing risk? So, what I'm focusing in on for this question is I am looking for the answer as far as high impact on reducing risk. So let's look at our options here. A, developing a reporting system for medical errors and injuries to staff and visitors. And before I analyze each one, I'm going to read through them. B, require assessments of high risk areas or processes within each service, department, and unit. C, use task forces to address key Joint Commission standards that apply to risk management. And D, educate staff on potential risks and patient safety practices. So I'm going to try to look for something that I could eliminate. Most impact on reducing risk. So, anything, educate staff, patient safety practices. I think I'm going to eliminate D because although it may have an impact on reducing risk, I don't think it has the most impact of the options. So I'm going to eliminate D, educate staff on potential risk and patient safety practices. Let me see. C, use task forces to address key Joint Commission standards that apply to risk management. While task developing task forces or using task forces to look at Joint Commission standards specifically to risk management, again, that may be something that you can do to reduce risk. But again, I'm going back to that most impact. And I don't think that task forces are going to have the most impact. So now I'm really focusing on A and B, developing a reporting system for medical errors and injuries to staff and visitors. While having a reporting system might help you track and identify medical errors, just having the system alone, um, I don't think would have the most impact on reducing risk. It's a great way to quantify your data and help develop root causes for those medical errors and injuries. But as far as actually reducing the risk and having the most impact of doing that, I'm going to look at B, require assessments of high risk areas or processes within each service department. So here, this B, it's like, where are you going to get the biggest bang for your buck? And that's what I am focusing on because it says the most impact. So do we have agreement or do we have any dissenters,
We
Richard?
have several people saying B.
Okay, let's
And
see.
I got to say, I would have liked A better if it included injuries to staff, visitors, and patients.
Oh, that's true. That's true. But a system alone, um, I still go back to my thinking that it's a great place to start to develop your strategies, but you're just collecting errors. It's, um, So even if it did include patients, I'm going to push back just a little and say that it still wouldn't have the most impact between A and B because you're really doing an assessment of those high risk areas and of processes, whereas developing a reporting system doesn't actually look at it alone, standalone at the process of what is causing higher risk, but still very close. Quality and performance. Let's see. Here we go. 5. We're halfway through, or almost halfway through. What action should you take to ensure that all critical activities associated with care of a patient are being carried out in the right sequence in your organization? So you're looking for an action. Critical activities with care of a patient are being carried out in the right sequence. So, a lot of components there with that question. Let me see if I can read the answers and see if I can eliminate anything right off the bat. So here we go. Institute clinical practice guidelines, develop clinical pathways, institute a disease management program, develop an evidence-based management program. So ensure that all critical activities are being carried out in the right sequence. So having programs such as the C and D, which are basically institute, develop, different words for sort of the same action, having a program itself, I'm going to eliminate these two answers because I don't think that that's going to necessarily ensure that critical activities or clinical activities are carried out in the right sequence. Guidelines and pathways, definitely for A and B. So seem to be more attuned to what the question is asking. So I'm trying to see Institute clinical practice guidelines, develop clinical pathways. Wow, Richard, these are almost like saying the exact same thing. It's like splitting hairs. Um, any feedback from the team or from the participants?
You've got a couple people saying B. Um, I agree with you. When I look at those two, I'm thinking, well, the pathway is kind of part of your guidelines, aren't they? But
Yeah,
when
clinical practice guidelines,
I'm
clinical
looking at the right
pathways.
sequence there in the question,
Yeah,
and a sequence to me implies more pathways where guideline is more broad. But
right. More guardrails.
yeah, it's almost like flipping a coin. And
I think
some
so, but
questions are that way. You just do.
yeah, I think looking at the question and focusing on that right sequence, the best possible answer, I don't think A is necessarily wrong, but I think a better answer is focusing in on that specific pathway. It's more specific. So to ensure critical. So I'm going to go with B. I think we had some consensus. Yes, B.
And we have B.
But that one would could be easily missed if you're maybe reading a little bit quickly and like I said, splitting hairs between guidelines and pathways.
Well, this is
Okay.
an example
Yes.
of how sometimes you're just going to flip the coin, right? So if you eliminated two, 50-50 is better than 1 out of 4.
Then
But it's also
25%.
a good one where
Exactly.
you might, just mark it on the computer at the test center, mark it and say, I'm going to come back and look at it another time later. Don't waste hours flipping back
Right.
and forth.
Okay. Here's a
Can
paragraph
I
for a
read something that
question. Here.
Someone wrote here, pathways provide the sequence of care, such as high HF, I don't know what that is, clinical
Heart
pathways.
failure, heart
Oh, thank
failure.
you. Guidelines are merely providing information on the best practices. So that's a good way to
Yes.
see the
So
difference
we're good.
there. So, yeah, thank you for that.
Okay. Yes. Thanks. Your medical staff on the general medicine unit has been complaining about the delays in the administration of medications. You study the processing times on other units and indeed find that the general medical unit times are considerably longer. What would be your first step to take? I guess. And doesn't really tell you first step to take in what in this question, but I'm assuming to improve the time for administering medication. So let's look at the answers here. A, implement best practices from other units. B, have the manager from the highest performing unit assist the general medical unit in its improvement efforts. C, establish benchmarks for processing times across the organization. Or D, organize a process improvement team on the general medical unit. So, as I'm looking at these, I think actually all of the answers are possible. So going back to the specific question, first step. So A, B, and C and D are all things that likely you would do in a performance improvement or process improvement initiative. But this question is wanting us to focus on what would be the first thing to do. And I'm coming down to D, which would be first put together your team to improve the process, because then the team could implement best practices from other units. The question already states that there's been some study of the processing time on other units. The manager from the highest performing unit assist the medical unit that's trying to improve. That very well may be something that I would, recommend bringing people who are performing at the highest level. And of course, establishing benchmarks for processing times across the organization. Um, Again, that's certainly something that I would recommend to measure and compare everybody within the hospital, I think, in this sense. But A through C seem to be things that a process improvement team would focus on. So first step I'm going with is pull the team together. Is that the consensus, Richard, on the chat?
That is the consensus. And it's funny because your logic and mine as you were talking was exactly the same.
Oh, good. That's a good thing when I'm thinking the same thing as you.
Yeah, exactly. That's how I
Definitely.
feel.
Okay, let's go on to 7. No, shorter answer, thank goodness, or shorter question and answers. What tool is most appropriate in identifying priorities for action? So if you are a Lean Six Sigma aficionado, this answer might be very intuitive. If you haven't done process improvement or received green belt or black belt, this may be something that you haven't touched since I don't know, maybe you went to graduate school. But uh, let's go through the options. So identifying priorities, a flow chart, cause and effect diagram, Pareto chart, or a run chart. Um, I'm gonna eliminate cause and effect diagram. Um, that may be something where you're going to use that to develop or identify your root cause of the problem for your process improvement. I don't think it's going to identify the priorities for action. The flow chart and the run chart. A flow chart is usually, mapping your process. Use that. Um, it could tell you, what the process is, maybe your current state and future state. But as far as identifying priorities for, let's say implementing a new process to, improve your outcome, uh, not thinking that a flow chart or a run chart are going to be what's going to identify priorities for action. So I am going with C, just on the process of elimination. Any other Six Sigma, Lean Six Sigma people out there, or people that use these tools on an everyday basis in their role have
I'm
any
I'm
difference
guessing,
of
The
but
Pareto
opinion?
chart it's the Pareto chart.
There we
It's
go,
because
Jack.
it's priorities for action. So Pareto's the 80/20 model, right? So whatever activities are going to get you the most out of what you're trying to do, that's what the Pareto chart's for.
Awesome.
And I'm
Okay.
guessing you had a couple of green belts or black belts in there because a couple of people jumped in immediately when the question came up and had the answer in.
Let's
Um,
see. There we
Mary,
go.
this is an example. I spoke a couple of weeks ago about one of the good preparation techniques is making a matrix of different areas just to be able to list things out. And if you're not, a quality expert, and I definitely am not one, maybe make a list where you have all the techniques that you can come across, and then just one or two sentences. What does it do? And that just would be a good way to organize your thoughts and to have a good study sheet.
Great. Okay. What approach best ensures loyalty, return visits by patients to your organization? So let's look at the answers here. Patient satisfaction surveys, patient engagement, an effective complaint resolution process, customer service training. Okay. Best approach to ensure that the patients come back. Uh, Patient satisfaction surveys. I certainly think that's a tool that almost every healthcare organization, I can't even think of a healthcare organization that I've worked for in the past, almost 30 years that didn't have patient satisfaction surveys to gather information as to why their patients are coming back or maybe why they're not so satisfied. But as far as ensuring a loyalty, I'm not sure the mere presence of having surveys is going to do that. B, patient engagement, definitely just in just general terms, whatever you're talking about, whether it's staff engagement, patient engagement, student engagement, usually engagement is a sign that people are vested with the organization or the process. And then C, an effective complaint resolution process. While that's important, I'm not sure that that's going to ensure the best option to ensure loyalty. That's kind of like the service recovery situation where things didn't go too well, and you want to make sure that you have an effective resolution process. And then D, customer service training. Um, while definitely customer service training of your staff, your providers, will help deliver high satisfaction. I think that if you're looking to the loyalty by the patients to the organization, I am eliminating C and D, and I already talked about how A, just the mere presence doesn't really ensure loyalty. So I'm going with B, engagement, because usually when people are engaged, they're more committed, attuned to whatever they're doing. Richard, any thoughts? Any people on with other
Well,
answers on the board?
that room is once again in agreement with you.
Okay,
Um,
and
my
yes,
my thought, by the way, on C is no, a better way to get loyalty is not make a mistake that causes the complaint in the first place.
exactly. Yes. So we're going with B. Yes, definitely. Okay. Two more to go in quality. A healthcare institution would use nationally accepted clinical benchmarks to A, determine what services the institution should offer to, I gotta move my here, to meet the needs of the area. Obtain a comprehensive view. B is obtain a comprehensive view of the state of the institution's business. C, evaluate the outcomes of a clinical process. And D, oversee the clinical structure of the institution. So, as process of elimination here, the question is talking about clinical benchmarks, and B, from my perspective, doesn't really, it's not really addressing or discussing anything clinical. So I'm going to eliminate B as a possible answer. A, determine what services the institute should offer. Again, the question is around clinical benchmarks. And although a healthcare institution um, may, determine what services that they should be offering based on patient need, but again, I don't think that that is a reason for using nationally accepted clinical benchmarks. Uh, over C and D. So now I've got between C and D that I'm looking at for this answer. Evaluate the outcomes of a clinical process and then oversee the clinical structure of the institution. Again, clinical benchmarks. Benchmarks are usually used, and you can have benchmarks for customer service, for quality data that you're gathering to evaluate that quality data or the outcome of your clinical services. I am going with C because I think that would be if the word evaluate and outcomes of a clinical process seem most aligned to the question of using a nationally accepted clinical benchmarks. Any dissenters? Or are we all in agreement that this one seemed a little bit easier? The answers seem to be a little more diverse and easier to focus in on the question.
No dissenters, but let me just point out, Enzo notes also that C is using clinical as one of the key words.
Yes,
So
and
that
we have clinical up
that
here.
says D,
Yes.
but C is the process part, not where D isn't. That key
Exactly.
word is a good thing to look for as well.
Yes. C. Okay, the last quality question before we go on to management and leadership. The dual nature of quality is important for healthcare managers to understand because, um, first off, dual nature of quality. Anybody in the group have an understanding of what they're referring to there before I read? I don't know. We're gonna just read the answers and see if we can figure it out by reverse logic here. Dual nature of quality evaluates not only the physician's ability to diagnose an illness correctly, but also evaluate the physician's ability to carry out a procedure related to that diagnosis. Wow, that's a lot to unpack there. Let's read B. It includes both content quality and service quality. C, managers can only impact administrative aspects of quality while physicians control the patient encounter. They must work together to achieve total quality. I'm not always in favor of questions that have words like only in them. So I'm gonna hesitate on C for now. And then D, each competing aspect of quality works against the other unless clear, defined management roles are embraced. Uh, I I'm looking at the shortest answer to this question. And the word dual and then the word both here. So both content and service. These others, managers can only impact administrative aspects of quality. I would say that's not necessarily true. Um, uh, Managers can impact clinical aspects by looking at the clinical process and helping that from that perspective. So I'm going to eliminate C. A, again, that word only, it evaluates not only the physician's ability to diagnose an illness correctly, but also evaluates the physician's ability to carry out a procedure related to that diagnosis. I don't know, Richard, but that's just sounds like a bunch of gobbledygook to me. I'm not leaning towards that either. So between B and D, each competing aspect of quality works against the other unless clear defined management roles are embraced. Competing aspects of quality, a dual nature of quality, I don't think that those two go hand in hand. They don't seem to be talking about the same thing. So I think just literally, even though I'm not 100% sure, what dual nature of quality is, B seems the most logical to me of talking about your content of quality. So maybe those are the outcomes of your clinical outcomes, and then the service quality is like how the medical care is rendered. So I'm thinking that's going to be my best answer, but this is for me somewhat of a guess. Anyone else a little bit more in tune to this dual nature of quality that can chime in?
You got three people who said B, but I want to point out that the answers came in much more slowly than normal, right? So I think everyone else is equally guessing. I did
Yes.
something you cannot do during the test, which is I said, I have no idea what dual nature quality is, so I Googled it. And dual nature applies in a whole bunch of other areas, but quality, nothing. So I think ACHE made it up just for this question. I have no idea.
Possibly. Let's see. And it's B. Okay. Well, process of elimination helped us out there. I definitely think so. Okay. Any questions before we go into the next uh, the next slide deck on management and leadership?
On the last question, I would just say the probably the easiest way to eliminate answer questions is due to their complication. Like so when you look at the A, B, and C, because they just are really complicated, you could probably find your way to that answer based on the fact that they kind of there's a lot of qualifications to what they're stating.
Got it. Got it. Got it. Okay. I'm going to use some, gonna get out of this. Well, let me just pull up the next one. Just over and go into my slideshow. Okay. The next section here is on management and leadership. So hopefully for this is a more general, I think general topic that most people uh, uh, deal with every day, as opposed to some of the other content areas that are more specific to specific roles. I don't have any updates or FAQs for this slide deck, but if we just didn't have any for today. Okay, these are the knowledge areas. And again, just I liked Richard's idea of a grid just on the key things here. And just very simply making sure that you've got a general understanding of each of these knowledge areas. And there are quite a few for management and leadership, two whole slides full. So a lot to unpack there as far as content, knowledge content. Okay, here are sample questions. We have 12 for this section. We'll jump right in. The purpose of capital expenditures committee is A, to oversee appointment of competent medical staff to render care for the service area. B, to appoint an effective governing board based on the wishes of the medical staff. C, to be responsible for evaluating and prioritizing requisitions for new equipment. And D, to implement stakeholder wishes on the future direction the organization should take. Okay, process of elimination, capital expenditures, capital, like large dollar depending on your organization's definition of a capital expenditure, is usually based on how much it costs. So appointment of medical staff and rendering care, immediately I'm going to eliminate answer A. The Capital Expenditures Committee is not going to appoint an effective governing board. So easy peasy from my perspective of eliminating B as well. C seems right on. Evaluating and prioritizing the requisitions for new equipment, which new equipment very well most likely is a capital expenditure. And then implement stakeholder wishes on the future direction of the organization. Yeah. A stakeholder wish, you might say, oh, well, the physicians might be a stakeholder in the organization in the sense that they want some specific clinical equipment, maybe robot or I don't know, something the latest and greatest. And you might think, oh, the capital expenditures committee might deal with those kinds of requests from internal stakeholders, but that's definitely not the most, or the best answer. The most clear-cut answer to me and the primary responsibility of an expenditures committee is for evaluating and prioritizing those requisition requests. So any dissenters? I think this one's pretty straightforward. I'm not going to belabor it because the other answers seem really far-fetched. It's like there's not even another close second, in my opinion.
No dissenters, and these came in much quicker than the last one.
Yeah, okay. See, we were right. Oh, I gave the answer. I clicked too fast, everyone. Oh, well. Ignore that little button there. We'll just walk through it and see. I apologize for that. The U.S. healthcare industry is highly diverse, and to address the ongoing challenges of workforce diversity, an organization should. Well, we'll read through the answers. Expand the market share by adding or enhancing services that target diverse population. Develop a linkage between the marketplace and the workforce that will enhance diverse recruitment, development, and retaining of employees. C, develop a diversity education tools available both to the workforce and to the community. And D, which unfortunately, because I clicked too fast, we know is the answer, develop and implement workforce policies and management practices, maximize the talent and productivity of employees with diverse background. So the question is asked, it has highly diverse and it also has workforce diversity. So those are the what you're looking to accomplish. Any ongoing challenges of workforce diversity. So C is develop a diversity education tools available to both the workforce and to the community. I think that one isn't a good answer because it talks about the community, and we're talking about here, the question is talking about your workforce. Educating diversity education tools for the community. I'm not so sure that's would be an appropriate answer because just kind of throwing in that community. B was develop a linkage between the marketplace and the workforce to enhance diverse recruitment, development, and retaining of employees. Challenges of workforce diversity. So would B necessarily address those challenges? A linkage between the marketplace and the workforce. I mean, I think that enhancing your your recruitment and your development and retaining of diversity would help, but I'm not thinking that is either the best answer because this linkage, as far as what we could use to address the ongoing challenges is a linkage. No, I don't think that that's going to do the most for the challenges. And then expand the market share by adding or enhancing services. That's more talking about from a patient perspective. So I would eliminate A right off the bat. So D, because it does talk about workforce policies and management practices, I think when you're developing policies and practices, and then it says talent and to maximize the talent and productivity of employees with diverse backgrounds. You're really honing in on the diverse workforce that you already have and how you're going to maximize that diverse workforce productivity and their talent that they bring to the organization. So even though I revealed the answer off the top bat, I think D has a lot of reasons why it would be the obvious choice. Richard, any thoughts on selecting D for this answer?
Well, first of all, only two people, you know, even addressed it for some reason. I don't know if it was harder or just the fact that they didn't need to. One person said final answer. Um, this one, I would have rewritten this question in my mind because that first part, the U.S. healthcare delivery is highly diverse and doesn't really answer the question. The question itself really begins with to address, what should the organization do? And the reason I think that might have helped is that when you think about diversity of the entire industry, it might lead you to think that B is a better answer than it is.
Mm,
Because B was my second best answer on this one. Whereas
right.
D is clearly the right answer, but D forces you to look at the workforce itself, where B
Yeah.
starts looking at both of those.
I think too, it's saying the US healthcare industry is highly diverse. So the question to me is stating you're already starting with a diverse workforce. So how does the management ensure that their already diverse workforce is, being the most effective and efficient? Whereas B is talking more about enhancing diverse recruitment, development, and retaining of employees. So that answer, while it seems like a great thing to do, it seems to me it's more focused on diversifying your workforce through employment or recruitment of diverse employees, where the beginning of the question is kind of stating you already have a diverse workplace. So when you have diverse workplace cultures, just there's a lot of challenges that can come up with having a diverse workforce in many ways. It could be diversity as far as culture, ethnicity, race, age. There's all kinds of diversity that you could think of. So that's why I think D was the best answer. Okay, I'm going to
It's a
click
good example,
slower.
though. Mary, this is a good example of don't rush through the question. You can take time to overthink all of this, but you'll improve yourself if you take the time and really say, what is the question really getting at?
Yeah.
And it seems like it's taking forever, but you really have plenty of time.
Yeah, and we're going slower, obviously, through these to a certain extent. If you come to a knowledge area that is your bread and butter, you might, go through those questions a little bit faster. Okay, a transformational leader adapts and applies evidence-based leadership in their practice, and the application of evidence-based practice in healthcare management is more challenging compared to the clinical practice setting because that's like a run-on sentence. But we're gonna unpack it as much as we can. What we're looking at the end of the sentence, and kind of Richard always says, read the sentence backwards. It sometimes helps. So the end of the sentences is more challenging compared to the clinical practice setting. So you're looking at healthcare management is more challenging compared to the clinical practice setting Because, okay, why is it, let's see, more challenging? The culture in healthcare management is much less professionalized with much less formal body of knowledge and great diversity among practitioners. B is the decision making in healthcare management is supported by various support systems such as handbooks and guidelines, making it complicated. C, the difference of the context or content of the research evidence from a clinical perspective to management perspective is non-comparable. And D, the culture in healthcare management is highly professionalized with strong formal body of knowledge. Okay, I'm going to look at A and D, excuse me, right away because A and D seem to be saying the opposite of each other. So I'm thinking I can eliminate one right off the bat by just seeing which one makes more sense to me. Um, when they say the culture is highly professionalized, professionalized to me refers to licensure. So your physicians have their medical license, your nursing has their nursing license, the LVNs. Your pharmacists have their license as well. So when they talk about professionalized, it means that the clinical aspect, the practitioners in the clinical practice setting have more licensure than, let's say, the administrative management side. Um, where you're studying to be credentialed as a fellow of the American College of Healthcare Executives. Well, that's a credential. It's not a license that's regulated by the state. So I definitely think that D we can eliminate because I may be missing something, but I can't think of any license that a management person may have specifically for management. Richard, can you think anybody on the call this morning think of a license that an administrative or leadership would have?
Um, Other than skilled nursing and other long-term care,
Oh,
so we have to keep remembering not to only focus on long-term or on acute care. Um, I would I would say less professionalized though is not necessarily licensure. I was thinking about even education, that no one is
mm,
going to become a physician without going to medical school, but
true.
there are people who have been promoted into management positions with no management training, for better or worse, often for worse. Um, but I mean, we don't have that same body of knowledge, and we definitely do have a great diversity in background among healthcare
Right.
managers of
Yes.
different levels, right?
I think so too.
Yeah.
So D I'm eliminating because the a strong formal body of knowledge management does, but you can have managements with MBAs, Masters of Health Administration, Masters of Public Health. I mean, there are so many different, even at the master's level or the doctorate level, so many different bodies of knowledge as opposed to I'm going to compare like a medical school or nursing school for the most part. Correct me if I'm wrong. The body of knowledge, maybe when you get into specialties in medical school, then it's kind of starts becoming more diverse. But um, when somebody goes to medical school, they're going to medical school and they're studying a more, let's see, uh, consistent body of knowledge, I guess you could say, from medical school to medical school. I mean, I'm sure there are differences from school to school, but much more concentrated and consistent in my mind than all the different types of degrees that healthcare leaders or management could obtain. So B and C, just to make sure that we're, because I'm thinking A is a really good choice here. Decision making in healthcare management, making it complicated. That answer doesn't necessarily have to deal with anything of a comparison, or if I think clinical practice settings are also supported by various support systems and also have handbooks and guidelines making clinical practice somewhat complicated too. So I don't think that that's uh, uh, an answer that fits the question. And then the last, the difference, the context and content of research evidence from a clinical perspective. So that C is just basically saying you can't compare the two. And I think you can. I think you can compare the management and the clinical practice setting from a, so I think A is the best answer. Any dissenters?
Actually, yes, you've got several here.
Oh,
You have
okay.
two
What are
people,
they?
you have two people who said C, and someone's pointing out that evidence-based practice is pertaining to research, which C does address. But my problem with C is that it cancels out the question that's being asked. The question is, what makes one more challenging than the other? And the
When you compare
C
them.
don't ask that question. We can't compare.
I
Right? So it
know.
doesn't really answer the question.
Yeah. So I am still going to go with A,
Right? You're going
and
against
there it is. What, I'm sorry, Richard, what did you say?
you were going against the crowd, that
I am. I'm going against the crowd.
if we did ask the
Um,
audience, you would not get the right answer here.
yeah. Okay. An effective emergency disaster preparedness plan includes triaging arriving injured, coordinating with other community resources, and A, hours of operation. An active command structure is B. C, payment for hospital personnel. And D, regulatory approval from Centers for Medicaid and Medicare and Medicaid Services. So when you're talking about effective disaster preparedness plan, um, I know we put uh, hours of operation. Usually, if you're dealing with a disaster, you're operating 24/7 until that disaster is addressed. So I'm going to eliminate hours of operation because I've never experienced a disaster plan only working between a certain 8 to 5. B, an active command structure. Definitely thinking that that is very well a possibility, but let's rule out C and D before I select it. Payment for hospital personnel. Um, whether how the hospital pays their payment for hospital. So payment would, I'm guess they're assuming that payments coming um insurance. I don't know. The C doesn't even make any sense to me. I don't know about you, Richard, but your hospital personnel are, part of your direct costs for running the hospital. They are going to be engaged in any disaster emergency preparedness plan. I don't think that payment for your staff is something that is going to come into play in disaster preparedness plan. I don't. And then last but not least, regulatory approval from CMS. Last I checked, you don't have to submit your emergency disaster preparedness plan to Medicare or to Medicaid. Um, Definitely as far as, being uh, accredited by, let's say, Joint Commission. But as far as Medicare as a payer, again, C and D just don't make any sense to me. And A is obviously no. So B, and I know, frankly, my hospital puts up an active command structure instructor for almost everything. So even the small earthquake we had that lasted about 20 seconds a couple of weeks ago. They had a command structure put up within moments. So I am going with B. Do we have consensus?
We do have consensus, and I would say C and D actually are tangentially related in that you do have, as part of your command structure, you have a finance person tracking
Mm,
expenses, but that's included under B, and it's a very much tangential. C is also kind of, or excuse me, D, kind of related in that to get deemed status with CMS for its approval, you get accreditation from DMV or
Joint Commission.
commission or someone, and therefore you must meet their standards on it. Again, not really a good answer, even though it's sort of true. So
Right.
use
It's not
that.
the best answer.
And I praise your hospital for doing the practice, whatever they can, of doing that. I think it's a great idea that more places should do.
I know they'll put up.
Yeah.
Yeah. Okay. Oh, I went too fast. I'm so sorry. Okay, we're going to read through it. A transformational leader adapts and applies evidence-based
No,
leadership.
no, we did this one already. We
Oh, we
went
did
back.
this one.
We
I
went
went
back.
backwards.
Yeah.
Oh, yeah, we did. Okay. Then I didn't go too fast. There we
Yeah.
go. Goodness gracious. Thank you. Committees are an important management tool primarily because A, they provide a mechanism for reconciling different opinions and facilitating decision making. B, they are the only way for providing for intra-staff communications. C, they keep staff up to date on new professional developments. And D, they ensure self-expression and participation by staff. So primarily, committees are important tool primarily. So I'm looking at the primary reason why we use committees. I'm going to eliminate B for a number of reasons because of that word only and intra-staff communications. Honestly, I don't even know what intra-staff means. Like, within the organization, and I don't think that's the
Between your
only,
staff.
committees are not the only way of communicating with it, with our staff internally. Keep staff up to date on new professional developments. They may, but I don't think that's the primary reason we have committees. D, they ensure self-expression and participation by staff. Do committees necessarily ensure self-expression? And is that the primary reason why we have committees so that staff can self-express and participate? Not in my opinion, not in my experience, but I do like A for a committee provides a mechanism. So you bring a committee together to build consensus, to discuss decisions, uh, whether they be around whatever you want to develop a committee on. So I definitely do like the word mechanism in A because they're talking about important management tool. So I'm looking at a committee, excuse me, as a tool. And then A talks about committees providing a mechanism, so a process for doing this. So I'm definitely looking at A. Any dissenters?
Yep. Everyone else is saying A too. And I like what you said about B, the problem with the only. I would say the same problem with D. Ensure is also an absolute. Not promote, not improve, but ensure it
Sure.
can
Yeah.
always happen. So I would
Kind of
really
black and white
about that.
thinking is always usually a red flag to really hone in on the question and see if the question really is asking for a singular response in that sense.
Yeah.
A. Okay, moving on to 6. Which one of the following statements is in accordance with the principle of delegation? So as management leaders, we all delegate. The executive who subscribes to the principle of delegation knows what he or she wants to accomplish and exercises control over the work schedule of subordinates. Delegation and control, somewhat of the opposite, opposing of each other. So I'm going to read all the other answers, but I'm not liking A just because of that word control and talking about work schedules, which really seems to not have much to do with the question, to be in all honesty. An executive explains how he or she wants things done, points out how the subordinate's contribution fits into the overall plan. I don't know. Points out how this once how they want things done. Usually delegation is less controlling, less specific. You can delegate someone to handle something and you're not really, specifically directing them how you want every T crossed and I dotted. Let's see. C, a successful executive gives instructions telling subordinates exactly that word. It's not going well with the delegation, how and in what sequence, even more so, things should be done. So C is opposite of delegation. So I'm pretty much going to rule that one out. Let's look at D and see if we have an answer here. In applying the principle of delegation, I like it already because it literally is restating what's in the question. An executive makes relatively few decisions personally and frames orders in broad general terms. Yes, I definitely am going with D because I think that that gives a nice definition of when you're delegating something to someone of how you should be delegating. Not everyone delegates in that manner, but I'm going with D. Who on the board?
Well,
Any dissenters?
apparently they delegated it to you to come up with the answer because none of them did. So
E. There we go. Oh, wonderful question. Short and simple. Which of the following is not an executive office function? So we're looking to uh one answer is going to be sort of different from all the rest when you have a not type of question. So, executive office function. Well, when I think of executive office function, I'm not thinking of control. I'm definitely thinking of leading. I'm definitely thinking of supporting. Representing. Executive office function represent. Yes, I think they represent. They can represent the staff. They can represent the leadership of the organization. Uh, I am going with A because A seems out of sort with the other three: lead, support, and represent.
and that's what everyone else said too.
Okay. Whoops. Wrong box to click there. A. There we go. Okay. Oh, order questions. Enough to blow your mind here. Let's see. Let's wrap our heads around this one. What is the correct order of stages for accomplishing organizational change? Okay, so we want to change something. A is identifying, planning, implementing, and evaluating. Liking it. But let's read the others. Planning, identifying, evaluating, and implementing. I'm going to get rid of that one because you don't plan before you identify what you want to change. That would make the first step very hard. Evaluating, planning, implementing, and identifying. So C is the exact opposite order of A. So let's just keep it there for a minute and let's go down to D, see if we can eliminate planning, evaluating, identifying, and implementing. Again, I don't think you can plan and evaluate. Well, you could assess something to determine a problem, but I think that first word planning is a no-go for me. If you're going to start to affect change or accomplish change, you're not planning in your first step. So I'm eliminating B and D, and then between A and C, definitely A is the right order for for accomplishing change. Any other
It looks like
counter
looks like
dissenters?
looks like people said A, but I got to tell you why I don't like this question, because are you identifying the problem or are you identifying alternatives? Are you evaluating the alternatives or are you evaluating after you've implemented to see if it's working?
Right.
I don't
Yeah.
really gives you enough information to answer this easily.
Yes. Um, yes. I think for change, just in accomplishing change, the first thing in accomplishing anything, if you want to change something, is identifying what you want to change. So that's why I go with A, with identifying first. At least that's my thought process this morning. Okay.
Someone's asking,
A.
is identifying
Yes.
concerns or identifying need for change? And that's really the question is what are you identifying? What are you evaluating?
I
That's
know.
here for me.
So maybe some of the skimpy questions are just as challenging because they don't give a lot of context. Okay. 9. In the field, I'm looking at time here. In the healthcare field, the accountability of management is best measured by. So we're looking at accountability of measuring the holding management accountable, basically. A, balance maintained between service quality and operational efficiency. Results shown on the annual expense and income statement. C, balance maintained between physician satisfaction and patient needs. And D, degree to which management's needs are met. Well, I'm going to eliminate D right off the bat because you're holding management accountable for and the degree to which their needs are met, it doesn't seem to it doesn't answer the question about holding management accountable. If it said somebody else's needs, like the patients or the staffs, or maybe, but not their own. A and C both start with the first three words are exactly the same. So I'm gravitating towards one of those two, but I'm going to look at B real quick to make sure. That's a financial, it's talking about finance. And while management can be and should be held accountable for their financial performance, it's not the only the only tool in the tool shed that management uses and is held accountable for. So I think it's too narrow of a scope to answer that best measured by in the question. So between A and C, physician satisfaction and patient needs. I, you also have patient satisfaction, you also have staff satisfaction. So I think that C is too narrowly scoped to be the best measurement, whereas A talks about service quality and operational efficiency, and that operational efficiency includes a whole host of, that's got, you know, so many things encompassing in that bucket there that I think that is a better and a more comprehensive view of holding a management accountable for their operations, and then the quality or the service quality, the quality of care that's being delivered. So I'm going with A.
As,
Any
as did everyone else.
Okay, there we go. Perfect. Okay, three more questions, and I think we've got just enough time. The cultural climate of an organization affects its recruiting procedure because A, it reduces employee turnover and absenteeism. B, organizations seek applicants whose attitudes, values, and goals are consistent with those of the organization. C, applicants who cannot support a given culture will be unwilling to work for that organization. And D, applicants look only to organizations that portray a positive cultural climate. Okay. Process of elimination. I think A, reducing employee turnover and absenteeism. We're talking about recruiting procedure. So employee turnover and absenteeism isn't really focusing on the recruitment process. So I'm going to eliminate that because that's, in my opinion, not dealing with the question. And we're basically talking about an organization's culture in its recruitment efforts. B, organizations seek applicants whose attitudes, values, and goals are consistent. That is looking like a very good answer because it's matching the applicants with the culture of the organization, which basically the culture of the organization is made up of attitudes and the values and the goals of the organization. So I think B is looking very good, but let's eliminate C and D just before we pick B. Applicants who cannot support a given culture will be unwilling to work for that. I mean, unwilling will it, I don't like this answer. It seems too specific. And while this definitely is something that maybe you wouldn't want to hire people that are not aligned with your organization. Just the way the question is worded, I don't think it's the best option. Focusing on cannot, like a negative. And then D, applicants look only to organizations that portray a positive cultural climate. Then there's that word only. Your applicants can want to be a part of your organization for a whole host of reasons. And so I think that D is too narrow of an answer to, I certainly, when I look for a job, I'd like to see a positive culture, but I wouldn't say that's the only thing I'm doing. So I'm going back to B because it just seems to me the most complete. It's talking about applicants again. So and then just hits the right there, the sweet spot of attitudes, values, and goals, which are what a culture is made up of. So I'm going to go with B.
We've got a difference in there between A and B
Oh,
in the chat room. Um, I like B as the answer, but I think it's real important to look at the negative there because you might want to reject it based on a negative feeling. The fact that we keep hiring people who have the same attitudes, values, goals, who look like us and sound like us and went to the same school as us is why we have problems with diversifying. So this is not necessarily a good thing, but it's still probably the best answer to this particular question. Affects its recruiting is not improves its recruiting.
right. Effects that, yeah. So effects could be positive or negative too in reading the question. Let's see what they come up with. It's B.
It is B.
Yeah, and I definitely see your point as far as consistent. Um and that B may be counter to diversity, but even when you have a diverse workforce, maybe that attitudes part might be somewhat different, but you definitely want alignment, even with a diverse workforce of the values and goals of the organization. As soon as you start hiring people that have different values or hold different values or goals, that can be problematic as far as maintaining a culture.
Yeah, although sometimes we want to, but no, but the problem is that sometimes we use these uh, as ways to substitute in other biases that are not good.
Yeah,
Oh, they
exactly.
just don't fit here. They're just not like us.
Yes.
That type of thing is obviously
Oh,
the
our HR, they have like, the red circle with the X through it or the line through it with fit. You never want to use, and I'm using the word never. They're like, never use the word fit. Like you weren't, especially when declining to choose someone to say they weren't a fit for the organization. It's a HR bugaboo, at least within my
well, it
organization.
should be.
Okay, two more and we'll be done here. In a dispute between two staff physicians, the primary role of the chief executive officer is to A, ask a representative of the governing authority to mediate a dispute, avoid any involvement in the dispute, meet meet with both parties as soon as the problem is identified, and D, request the appropriate chiefs of service to investigate and report back. Okay. Well, possibly a chief or anybody else want to avoid involvement in dispute. It's not my favorite thing to do in my job. Um, I don't think that is the answer as far as the primary role of the chief executive to avoid something. So I'm going to eliminate B. Uh, I'm not really quite sure. Governing authority, maybe they're referring to the board. I'm not really sure what a representative of the governing authority. Um, I don't think that's the primary role of a chief executive is to ask for somebody else to do something as far as the governing authority to mediate a dispute between two staff physicians. Um, so I'm going to eliminate A. So between C and D, meet with both parties as soon as the problem is identified. Um, well, that might be something a chief executive may do. I think that D is the so asking the chiefs over the physicians, like, their staff physicians, so maybe asking the requesting that the appropriate chiefs of service investigate and report back what the dispute, regarding the dispute. Um, and then at that point, the CEO meet with the physicians, or maybe even just, be aware and that it's actually the chiefs of the services that are mediating and identifying the dispute, because I can be, uh, I don't know about staff, physicians who have disputes, but I deal with a staff who have disputes all the time. And as the management, um, I definitely want to make sure that I get to the bottom of anything as far as what's going on, what the situation is before doing anything. So I'm going to say D because I like the investigate and report back piece. C, I think is true, and maybe the as soon as is the hang up for me on C and why I wouldn't pick that one. Any thoughts, Richard? Any
Other people,
answers from the field?
yeah, other people are saying D. I would say C is wrong in that I would want to keep the CEO out of the weeds here,
Right.
right? That's not the
True.
first thing is jump in and solve it yourself when you've got 5 layers of staff between you and them.
And the physicians,
Yeah, it
yes.
may also be what's the dispute about? Is it, that my hamburger was overcooked and I want to fire everyone? Or is it that, we're killing patients because we can't get meds to them fast enough?
Yeah, exactly. Just the dispute is it's kind of nebulous here, so
Yeah.
you got to look at generalities.
My problem with D is I
D,
like to request them to investigate, and I would say report back if they can't figure it out on their own. Don't come
right,
to me if I don't need to know it.
defending, yes.
Yeah, and some
And I don't know if the CEO would even be, I mean, would even be involved in two staff position. I think that that's typically handled by the service chiefs, in my opinion. So that's why I liked this appropriate chiefs part of the service and the
this
answer,
question,
because
sorry, go ahead.
no, no, go ahead.
This question also, though, in terms of prepping for the test, is a good example of how you need to know the trilogy or the Trinity rather, sorry, the role of the CEO, the role of the board chair, and the role of the medical staff head, and know where the lines are drawn and where the gray areas are among those three, because that'll help you answer questions like this.
Exactly. Your little matrix idea again. Okay, last question. For most members of well-managed organizations, the front office is a source of authority, a resource and a guide, a major stakeholder, or a decision maker only. Um, the front office, when I think of front office, I'm thinking, I'm in clinical operations, so I'm thinking about the staff, the PSRs that are checking in patients, but definitely not a source of authority. Definitely the front office can be a resource and a guide, so I'm liking B. A major stakeholder, uh, I mean, they're definitely a stakeholder, your frontline staff. Major, debatable. Um, and then a decision maker only. There's that only word. And of course, the front office does more than just they're making a decision. Uh, so I'm going with B, a resource and a guide. The front office is like they're the main point of entry for our patients. And they do a lot to also support staff and clinicians. So I love the word resource and guide because they often do guide the patients through a lot as well. Any other
And,
thoughts on
and
this one?
everyone else said B too.
B.
As well. Two thoughts on this one, if I could. One
Yeah.
is when it says a well-managed healthcare organization, don't necessarily think of your own, right? Because yours may not be well managed. But it's also a good plug for the book, The Well-Managed Healthcare Organization,
Yes, it is.
mentioned before.
But
It's such a great resource for this test.
I hope we all work for well-managed organizations, though, too, from that perspective. Okay, let's see. The final answer with 1 minute to go. B. And I just realized my voice was pretty hoarse today. I teach San Diego State, and they were having student gathering, like a little happy hour for the students, and it was in a pretty loud venue. So just talking was a stretch. So I apologize for my hoarse voice this morning, but I made it. Hopefully you found this session helpful. And are there any questions or answers before we dial off? It's 11:30 on the dot. Couldn't have gotten it more close to the timeline. Any other questions?
Someone's asking the name of the book I just mentioned. I'm putting it in the chat.
The Well-Managed Healthcare Organization. It's a good sort of like just general comprehensive, just touches upon every nook and cranny and kind of nice I think refresher if you do have to kind of study content from a knowledge area perspective. It's pretty
Yeah.
comprehensive.
If you're getting
Any
just
other?
one,
Yes? What, Richard?
I said if you're getting just one book, this is the one.
Yeah, exactly. Okay, everyone. We've got one more session, right? So we're almost down to the end. Let us know if you have any questions, concerns, always reach out. And otherwise, we'll let you go and enjoy your weekend. I'm going to say from one mother to any mothers out there, happy Mother's Day. Hope you enjoy the weekend. Okay, thank you.